Let me start with a question. How many pills are in your medicine cabinet right now? Pain relievers, diabetes drugs, heartburn meds, sleep aids, the usual. Now imagine this. Some of those very medications could be quietly damaging your heart every single day. And here's the shocking part. We're not talking about illegal drugs or experimental treatments. No, we're talking about common prescriptions millions of older adults take daily, sometimes for years, without ever being warned about the risks. Cardiac surgeons and cardiologists across the globe are sounding the alarm. They're seeing heart damage that doesn't match the age or health profile of their patients. Inflammation off the charts, weakened heart muscle, irregular rhythms out of nowhere. And when they look deeper into patient histories, they keep finding the same medications. Research from major medical centers, Cleveland Clinic, Johns Hopkins, European Society of Cardiology, now confirms what many doctors suspected for years. Certain medications are linked to measurable, documented heart damage in older adults. Not one in a million side effects, not rare cases. We're talking about large percentages of users, everyday seniors. Some drugs raise heart attack risk by 40%, others double or even triple abnormal heart rhythm risk. But one drug, one very common medication, is now being called the silent heart killer. Some experts even believe it deserves a black box warning, the strongest medical caution there is, especially for older adults. But before we reveal that number one drug, let's go through the full list so you understand exactly what might be harming your heart right now. Before we continue, leave a comment telling us how old you are and where you're watching from. We read and reply to every comment. All right, let's begin. Number 7. Proton pump inhibitors, PPIs. Prilosec, Nexium, Prilosec. These acid reflux medications are everywhere. They help with heartburn, ulcers, and acid reflux. Short-term, fine. Long-term, years or decades, that's where trouble begins. A massive study of nearly 3 million people showed a 16 to 21% higher risk of heart attack among long-term PPI users. Stanford researchers later found double the risk of cardiovascular death in people with coronary disease. Why? PPIs reduce nitric oxide, a molecule that keeps blood vessels relaxed, prevents clots, and lowers inflammation. Less nitric oxide equals stiff arteries, plus higher blood pressure and clot danger. The good news is, many people can switch to safer options like H2 blockers, famotidine, and lifestyle habits, smaller meals, no eating 3 hours before bed, weight management, sleep with head slightly elevated. And this was just number 7. The list gets more serious from here. Number 6. Certain antibiotics, fluoroquinolones, Cipro, Levaquin, Avelox. Life-saving drugs, yes, but in seniors, they come with major heart risks. A study involving more than 7 million patients found fluoroquinolones increased the risk of aortic aneurysm or dissection by 66%, dangerous heart rhythm issues like QT prolongation. These problems can appear within weeks and sometimes lead to sudden cardiac events. In fact, risks remain elevated for up to 60 days after use. Often safer alternatives exist: amoxicillin, nitrofurantoin, trimethoprim, sulfamethoxazole, depending on the infection. Always ask your doctor whether a different antibiotic could work first. Number 5. NSAIDs, non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, Celebrex. These painkillers are household names, and for occasional use, they're usually fine. But daily, long-term use, especially in older adults, is where the danger grows. A Lancet meta-analysis of 350,000 plus patients found ibuprofen 44% higher risk of heart attack, diclofenac 41% higher, Celebrex 37% higher. NSAIDs raise blood pressure, increase clotting, and trigger artery inflammation. Even short-term use raised risk within the first week. Safer approaches include acetaminophen, Tylenol, topical NSAIDs, physical therapy, and mobility exercises. If pain is chronic, alternatives exist. Discussing them with your doctor matters. Number 4, older diabetes medications, sulfonylureas, glyburide, glipizide, glimepiride. These drugs force the pancreas to release more insulin, but studies show they increase cardiovascular risk, 20% higher cardiovascular death risk versus metformin, higher heart attack rates in multiple trials. They may cause low blood sugar spikes, trigger stress hormones, and accelerate artery plaque buildup. Better alternatives today include SGLT2 inhibitors, empagliflozin, dapagliflozin, GLP-1 agonists, semaglutide, liraglutide. Many of these protect the heart instead of harming it. If you're on an older diabetes drug, this is worth a conversation with your doctor. Number 3, certain sleep medications, Ambien, Lunesta, Sonata, plus benzodiazepines. Insomnia is frustrating, we get it, but long-term use of these sleep medications increases cardiovascular death and makes sleep apnea worse, a major heart risk factor. One study showed a 4.5 times higher mortality rate among users. They can cause breathing suppression at night, irregular heart rhythms, falls and injuries, hospital stress to heart attacks. Better sleep solutions are CBTI therapy, consistent sleep schedule, dark room, cool temperature, low-dose melatonin if needed. Which brings us to number 2, antipsychotic medications for agitation, dementia behavior symptoms. Common in nursing homes, often overused, but studies show double the risk of death, mostly from sudden cardiac causes. These medications can cause dangerous heart rhythm changes, increase weight, blood sugar, and cholesterol, trigger blood pressure drops, falls, hospitalization stress. Black box warnings exist, yet prescriptions continue. Behavioral or environmental adjustments often reduce the need for these meds. Number 1, the silent heart killer, opioid pain medications, oxycodone, hydrocodone, morphine, fentanyl, tramadol. According to many cardiologists, the most dangerous of all for seniors. A study of 575,000 plus adults over 65 found 65% increased risk of cardiovascular death. Another study found risk more than doubled in the first 30 days of use. Opioids suppress breathing, low oxygen, heart stress, reduce heart rate variability, a bad sign, increase inflammation and artery plaque buildup, interact dangerously with sleep meds and heart drugs. Pain relief is important, but safer long-term strategies exist. Gradual tapering, doctor-supervised, physical therapy, nerve blocks, non-opioid pain management, cognitive pain coping strategies. Sometimes pain even improves after reducing opioids because long-term use can increase sensitivity. This video is not telling you to stop medications on your own, but it is urging awareness and conversation because heart damage from medications is often preventable. So tell us in the comments. 2, are you taking any drugs on this list? 3, are you considering speaking to your doctor after watching this video? What worries you the most? Your story might save someone else. Thank you for watching. Stay informed, stay healthy, and protect your heart.